So one of my friends wanted to know, since they're getting their shot very soon and they're not very like educated with some of the side effects. They wanted
Mhm.
to know, what are the side effects of the shot and how long would you say it lasts?
Yeah. So I have some stats for you. 84% of people have pain at the site of injection. No duh, right? Um, 63% of people report chills. I'm sorry, fatigue. 32% report chills. 24% report joint pain, just kind of achiness. 14% of people have fever. And those last for a day or two, uh, and more so with the second shot than the first one. That's just a sign that your body's doing what it needs to do. It's a sign that your body's building immunity. It's ramping up to make those antibodies that will then just kind of swim around your body to detect if you virus if you get exposed. It's really a pretty well tolerated vaccine. Those things we think of as side effects that make you feel a little bit crummy after getting it are actually intended. And we shouldn't even think of them as side effects. We just think of them as the point is creating antibodies. Did
So
you feel it? Have you felt any of those?
I've when I first got it, I kind of got really tired, but it was also because I didn't get very good sleep that night. So that might have been that.
Ah, uh-huh.
But right now, since I got it yesterday, I just feel like soreness in my arm where I got the vaccine. So that's
Yeah.
really it.
Yeah, my
Yeah.
son, my son's 13, and he got his yesterday too, and the same thing. He was looking a little sluggish last night, and wasn't really excited about getting up to do his algebra online today. But he's doing fine now, and I think he's going to go mow the lawn. So, you know,
I understand exactly how I was feeling. I had to wake up and do math testing today, so that was
there you
not
go.
fun for me. The next question I have for you is, so the same person who asked about the side effects, they want to know what they can do before they get the shot to help them not have as bad as side effects. So like, what can they do to not feel as much pain or not get as tired?
Yeah, well, I think the first thing that we just figured out was maybe making sure you get a good night's rest before getting it, right?
Yeah.
That's just the dad in me coming out. We don't really want you to pre-medicate with anything because we wouldn't want to decrease the response, your body's response. So again, we kind of want your body to ramp up a little bit, which may result in a little bit of, what people might call low grade fever or feeling a little bit crummy or low energy. But if you do start to feel crummy later after you've been vaccinated, an hour or two later, you start to feel that way, or maybe it's later that night, it's okay to take Tylenol or ibuprofen. Most authorities are saying that's fine and probably not going to result in a lesser reaction or intended response to the vaccine.